Let's catch up again with Professor Catherine Bennett, who's the Chair of Epidemiology at Deakin University. Good to talk to you again, Catherine.
Hi, Chris.
Especially coming to us from Melbourne. Unpick this for us. Daniel Andrews, highly critical of New South Wales. He says the virus is running wild in New South Wales. It's on fire. So you've got to go quick and hard and early and get on top of it in Victoria. But with this Delta strain, he's now going at least 28 days. He's not able to get on top of it, even though the numbers early on were so modest.
That's right, Chris. And I think it's really important that we understand it's actually very different to what we looked at last year. And I don't think comparing, Sydney now to what Melbourne did last year was ever helpful, really, because this virus operates differently. In fact, we just had data out of the UK, and before they came to their Freedom Day, when they got their vaccination rates really high, so they were sitting well over 50% for the whole population fully vaccinated, and they still had lockdown in place, not as strict as ours. Their reproduction number, that relationship between cases, 1 week to the next, was sitting at 1.2. And Sydney's managed, without that vaccination coverage, to at least contain it to that for the last 30 days. So they've been working hard to achieve that. And I think it's very easy to sit outside and say, well, you should have closed it down, lockdown's not strong enough, all these other criticisms, when in fact, what we're finding in places like Melbourne, as you say, it's so hard to contain, even when you've got lower numbers and you've got the heads up from Sydney. So I just think we have to realise how difficult this variant is. It's faster, it has a shorter incubation period, and it infects more people quickly when it gets into a household. That's why it is so hard to contain.
Now, these are diabolical dilemmas, and they're very complex, and someone like you spends their whole professional working life delving into them. But each pandemic, each epidemic, each virus is new. But we still haven't seen, have we? I'm not suggesting we've got to do this, but you've got to think about this. Obviously, you do. You haven't seen what will happen with this virus, say in the Sydney cluster, without such a hard lockdown, with less onerous restrictions aimed to try and slow the spread. You just don't know how you can slow and contain it, do you? Until we won't wait to find out until we hit 70%, presumably. And then, in effect, you're conducting something of an experiment with a keen eye, of course, to what's happened in the UK and elsewhere.
Yeah, absolutely. And other countries that have seen these waves of Delta weren't at zero. So we do have quite amazing information about how the virus takes off from scratch, here in Australia. And unfortunately, that hasn't been a good story. In fact, the way New South Wales approached it was to really keep an eye to their containment and look at where the transmission was, and then follow it with their intervention so that they would try and get on to areas of risk for transmission faster. They went into lockdown faster than they've done before, but they actually tried to tailor that to where they saw the transmission. The challenge with Delta is when you do that, you're still at best running beside it. You can't get in front of it if you're waiting for the virus to kind of tell you what's next. So we have learned a lot actually out of Sydney, because they did take this stepped approach where they were following the data, seeing the information coming in. Other places like Melbourne and South Australia went in very hard, very broad. And again, you don't quite know whether you needed all of that, but it worked certainly in South Australia's case. But in Melbourne, even that didn't work. So I do think this is a terrible time where we've got these couple of months ahead to get our vaccination rates up. But boy, would it be great to get through those, because I think Delta's just proving everything we did know about control is now we have to relearn it. We have to absolutely evaluate all of this. But at the moment, we're just desperately trying to keep those numbers at bay while we get the vaccination rates up and stop seeing people in hospital.